Welcome to Talking in the Neighborhood. I'm your host, Tim Brown. This program is sponsored by Philly Neighborhood Networks, whose mission is to engage, educate, and empower our neighbors to support policies that put people and planet first. We'll be talking about some of those policies today as we try to answer the question, what's up with Medicare? In particular, we'll be laying out the current Medicare situation, who it's meant to serve, and why it's so important for our city residents and for our nation. In particular, we'll dig into disturbing developments surrounding Medicare that's funneling our taxpayer money into private institutions, all of this driven by unscrupulous speculators. Joining us today are two well-known healthcare advocates. First, I'm happy to welcome Dr. Judy Albert, a retired medical director at Reproductive Health Specialists and a board member for Physicians for a National Health Program. Thanks for joining us, Judy.
Thank you.
Also joining us is Dr. Walter Tsou from the Center for Public Health Initiatives at the University of Pennsylvania. He's a nationally known consultant on public health and healthcare reform. He was president of the American Public Health Association, former health commissioner for the city of Philadelphia, and currently a national board advisor for Physicians for a National Health Program. Welcome, Walter.
Thank you, Tim.
So I wanted to, we're going to dig into the weeds in this program a bit, but before we do, I think we need some fundamental questions answered so our audience can follow along with us. So a real basic question here is, what's the difference between Medicare for all, universal health care, and a single payer system? Who wants to take that on?
Well, I'll take that. The generic term universal health care suggests that everybody should have some type of health insurance, or at least access to some type of healthcare services. But it's sort of, a vague term, and a lot of politicians hide behind the term universal healthcare. Arguably, if you require everyone to buy health insurance, which is what the original thoughts were behind the Affordable Care Act, then they claim that you get universal healthcare. However, they managed to exclude some people that they don't like immigrants, those who are undocumented, those who cannot afford to buy private health insurance. And so the term universal health care is a bit misleading in America. That's in contrast to the concept of Medicare for all, or more like synonymously single payer health care, where the government actually would fund healthcare for everybody in this country. If you can fog a mirror, you're basically in the system. And everybody, regardless of their immigration status, their sex, rural or urban, rich or poor, young or old, they're all going to be covered under a Medicare for all single payer system. So in a nutshell, a much better system for us as a country would be something like a single payer Medicare for all system.
Okay, great. Judy, any thoughts on that?
Yeah, I think, before people get too wigged out by the idea that the government would pay for healthcare, it's worth noting that the United States is the only economically developed nation that does not have a government-sponsored healthcare system. And as a result, we think we also show very poor outcomes in a number of measures, such as life expectancy, maternal deaths in particular, and infant mortality, that are literally the bottom of the most economically developed countries in the world. And there's data on that that's collected every year. And so, the other part of it is, historically, the Johnson administration was the era in which Medicare was passed as a law to provide care to elderly people. And at the same time, Medicaid was sort of, many concessions were made to the southern states who resisted the idea of providing care to their indigent population. And so Medicaid was farmed out to the states and doesn't work in the same way as Medicare does. So Medicare, all you have to do is reach the age of 65 and you're covered. But for Medicaid, it's what's called a means tested system. So you have to meet many different criteria for how much money you make and how poor you are. And if you rise above and below the different levels of poverty that are used to allow you to get Medicaid, you'll be kicked in and out of a system like that with and not have your coverage, which is very detrimental to people's health. So that's kind of the overview of government care that we have today.
So research shows that most Americans really want Medicare for all or some single payer coverage. And the Pew Research poll recently showed that close to 70% of Americans believe that the government should provide this Medicare for all program. So why don't we have it? What's holding it up? Well, everybody thinks this is such a great idea, and you hear all the politicians talking about how wonderful this is. Why don't we have this system?
The reason why is because it's an indication of how democracy doesn't really work in this country. Because as you point out, the majority of Americans actually do want Medicare for all. Even something like 40% of the Republicans want Medicare for all. And that's because healthcare is so expensive, so complicated, so convoluted that nobody can figure it out for themselves. And people, even rich people, are afraid of getting sick in this country because the bills that are generated out of hospitals are insane. You know, it's like one day in a hospital emergency room, you can get a $10,000 bill. I mean, that's ridiculous. What kind of country does that to bankrupt its own people just because of the mere sin of getting sick in this country? So why don't we have it? It's because of the medical industrial complex, the private insurers, the pharmaceutical companies, the very wealthy doctors, the medical equipment people, all the people who really suck at the teat, if you will, of the healthcare system, make billions, literally billions of dollars off of it, sucking out of mostly from the taxpayers of this country and those who pay premiums in order to enrich themselves. And they don't want to change the system. And so they pay off the politicians to make sure that the system stays the way it is and not a true Medicare for all system.
So I guess this seems like a simplistic question, but so why is it important to have a system like Medicaid in place?
Medicaid or Medicare?
Medicare.
Well, Medicare, as Judy pointed out, you turn 65 and you're in. I mean, how simple can that be? And the enrollment is very easy. So if we were to have Medicare for all, then literally upon the day you're born, you would already be into the healthcare system. And it would simplify things. You don't have to figure out, my insurance pays this and I have to pay a copay for that. And then I have a secondary insurance for that. And then, all this other convoluted stuff that is uniquely American that, nobody can really understand. I mean,
Judy, would that affect you as a doctor? Is that something like you have like all these different insurance companies or something to deal with, or like?
Yes, yeah. I mean, so one of the beauties of Medicare is its very low administrative cost. So, if your patient population was all Medicare patients, and they chose straight fee-for-service Medicare, you wouldn't be dealing with, a panel of 15 different regional health insurance companies to try and process your claims. So as a physician, your overhead would decrease because, in my private practice, we had a billing person employed for every physician. And the outrage of the amount that we spend on overhead is just that. And also, to the point of, well, what's better, Medicare or Medicaid, or, which one do we want? Medicare has become the model because of its simplicity. As Walter pointed out, you're 65, you enroll. We can look to that as a publicly funded system that actually works in its efficiency. They have excellent health outcomes. And they have the most recent percent of overhead that fee-for-service Medicare reported is actually under 2%, which compares unfavorably to private health insurance that takes in the 14-15% overhead. That means a significant portion of that 14% is going to profits and not paying claims. And where did all the money come in the first place? From our private insurance premiums.
Right. So it seems to me we have Medicare right now, and it's a public system that is far superior in its simplicity from private healthcare, and delivers, I assume, the same results, at least, as the private healthcare, except in obviously some certain circumstances. So what would it mean if we privatize Medicare? Walter?
Well, yeah, go ahead, Walter.
Well, I think it's a disaster already. Actually, Department of Health and Human Services Inspector General recently reported about a privatized version of Medicare right now called Medicare Advantage. And what they found is that the insurance companies basically denied a lot of claims that should have been paid. So these senior citizens were not getting the type of services that they wanted. And lo and behold, what better deal is there for a private insurance company than to not pay claims, have people dissatisfied with the insurance they have, and yes, you are so expensive that you decide on the next enrollment period to leave the Medicare Advantage plan and to resubscribe into original or traditional Medicare. What a great deal for them, because essentially they can make it so difficult for those who are really sick to not get the care they need, and keep for themselves all the people who are healthy and collect the premiums that they're getting from the Medicare program. So it's a tremendous ripoff to the tune of tens of billions of dollars that the Medicare Advantage plans have. And no wonder they want to keep the system the way they have it, because it's a money machine for them right now. But the losers are the taxpayers of America, and in particular, the senior citizens who are being denied the care that they deserve.
Judy, what are your thoughts on this?
So all of that is so painfully true. And I think, one of the things that sadly, we really have to admit that enrolling in Medicare is not as simple as it used to be. I mean, when there was fee-for-service Medicare, that was your choice. But now, probably your listeners are aware of the vast amount of marketing materials that hit the airwaves in our mailboxes once we are 65, encouraging us to sign up for Medicare Advantage plans. And the ads are very confusing. People don't know that they're signing up for a Medicare Advantage plan. And why is that important? Well, Medicare Advantage plans are run like HMOs. They're a closed system. So when you agree to Medicare Advantage, which, by the way, often gets you a very much reduced monthly premium compared to fee-for-service Medicare, and some other little benefits that make people feel good, like a little bit of dental care, a little bit of vision care, and a gym membership, so otherwise known as silver sneakers. It sounds good, but then the problem is that you are in a narrow network, and you might not be able to see the same doctors you've seen for all of your healthcare during your younger years, because they might not be in network, and you oftentimes can't find all of that out. If you happen to be in another state where there's no network providers in your Medicare Advantage system, then you may not be able to get care. And then on top of that, it's run as a capitated system, meaning that the government is paying the health insurance a certain fee for each individual who's enrolled in that plan. So they get the money up front. So if it's your Aetna a Medicare Advantage plan, they're getting your premium, and then they're not paying out claims. Just as Walter said, they're denying care. They're making you jump through more hoops to get pre-authorizations. to the point that you just get so frustrated, you say, I don't want this plan anymore. And if they deny your care, they get to keep all that extra premium. That's where that overhead comes up. So they are draining the Medicare fund that we've all paid into through Social Security through our whole working lives.
So is there a fear that it could bankrupt this system?
Oh yeah,
Well,
there's
so,
definitely a fear.
so Walter, what happens to all those people then?
Wow. There is
To
a
those of
Medicare.
us who are moving up on into the Medicare range.
Well, you know, by the time you reach Medicare age, Tim, it's very possible that Medicare will be projected to be bankrupt. I think it's something like 2030 or something like that. It's going to, it may sound far away, but I mean, that's not that far away,
No.
that it could cross over and not have enough funds to pay all the claims. And Medicare needs to be much, much more efficient, and it cannot really afford the Medicare Advantage program or any of these privatization schemes that are being used to suck the money out of the Medicare trust fund. And that's really one of the big problems that we have.
So we talked about Medicare Advantage. We see the commercials on television all the time, and we see that there are some problems with this Medicare Advantage. I wanted to delve a little bit deeper into this because people know it as Medicare Advantage, but there is a thing called a direct contracting entity, which is how this thing gets turned into sausage, right? Can you explain a little bit about this? Because while it's in the simplest terms you can for our audience, in how this is actually taking place under the radar.
Well, I'll start. Let's say the Center for Medicare and Medicaid Innovation was one of the parts of, was one of the parts of the Affordable Care Act. And they're allowed to experiment, if you will, with different ways of trying to deliver care, presumably as long as it doesn't cost Medicare more money. So they have been lobbied by these Wall Street private equity funds to say, we can do primary care for you for the Medicare patients, and we'll coordinate their care, and we'll do it for X fees, and it will be a better deal. And the thing that's really most disturbing is that both Republican and Democrat legislators have bought into this and have allowed these direct contracting entities, these Wall Street firms, to basically take over the primary care programs of the Medicare patients. And they have the right, if you will, to, if you maybe saw a doctor one time, they could auto assign you to that doctor who may have joined one of these direct contracting entities, and you don't realize it, but now all of a sudden your new primary care is coming from this Wall Street firm that you had never heard of, like Oak Tree Health or Clover Health or all these other companies that are sort of on the horizon that are trying to take over and privatize the Medicare program. Judy could say more about this.
So yeah, I think also just to maybe back up a little bit, because it is very confusing. So when I recently signed up for Medicare when I turned 65, and you have a choice to choose traditional Medicare or Medicare Advantage, and it's an active choice that everybody has the right to make. Right now, just as an aside, and again, the fear of this privatization is quite warranted, because as of, I think, 2022, we're nearly 50% of Medicare beneficiaries are on Medicare Advantage plans. And that's been a huge increase since Medicare Advantage was allowed to enter the field. So anyway, back to when we enroll. We enroll as a traditional Medicare. I want to keep all my physicians. I want to be able to use my health care anywhere in the United States. And I don't want to have to worry about pre-authorizations and so forth. But this direct contracting entity, which was dreamed up by the Centers for Medicare and Medicaid Innovation, that was actually put in place by the Obama administration under the ACA is all constantly dreaming up ways that they think they can save money. And so how they're saving money is, again, just denying care and figuring out ways to manipulate people. But perhaps most disturbingly, I could be a person who actively signed up for Medicare Advantage, and suddenly, as Walter said, you find yourself in this other entity called a direct contracting entity, or they're actually now, they changed the name because our organizations that are Social Security Works and PNHP and various other organizations that protested through congressional representatives, they did change the formula a little bit, but really just in name. And so now it's called ACO Reach. So you could be assigned without your permission to an accountable care organization, or ACO. And even your physician might not know that they are in this accountable care organization. Could it be any more confusing? So you can't even find out if you get a letter from Clover Health that says, welcome, we're going to be helping your doctor coordinate your care. Well, that might sound good, except what does that really mean? And, one of the things that it means with Clover Health is that Clover Health also offers its physician members access to use software programs that can help them code your care at a higher level of service. And that means they can gin up the level of severity of your disease state, and that gets them more money paid out by Medicare. And this has been one of the major problems with Medicare Advantage as well. So, all of this is going on behind the scenes, and you can see how something like this could sort of slide under the radar, because, even when some of us that were familiar with healthcare issues tried to understand it, it's very hard. And when we went to Congress last November and talked to staff and Congress people, the vast majority of them knew nothing about it.
So this program has actually started, and it's supposed to actually blossom starting January of next year, 2023. And the big ask that we have is to tell people and to tell Congress not to support this ACO Reach or direct contracting entities privatization of Medicare. Because if the entire Medicare program, which is their goal, is actually in the hands of Wall Street and private equity funds, then what's the point of Medicare for all? It's basically saying we're going to have everybody in the Medicare program under the thumb of one of these Wall Street entities. And that is actually the antithesis of what we think should happen. We want to have free access to any doctor, any hospital that is the best person to take care of your illness, and not be restricted, which is what these in-network, out-of-network type private entities will do if we privatize the Medicare program.
So we are, we're getting, it's 2022, 50% of Medicare folks are taking part in Advantage programs. They're being assigned without permission to these various ACOs. They're being denied care. Money's being drained from the system, and it looks like we could possibly have a bankruptcy in 2030 of Medicare. This all sounds pretty bleak. I know that you've been talking about having conversations with members of Congress. What are the next steps for us? What do we need to do right now to wake up Congress, to move things in the right direction? Is it just hopeless and we're going to be stuck with a system that is just privatized, or can we actually do something about this?
Well, you can't, it's hard to do something if people don't know what this is all about. So part of the reason why we have this show today is to actually inform people of this new threat to privatize the Medicare program. And I think we're asking more and more people to join us at Physicians for a National Health Program and Social Security Works and a whole host of other groups, and say, hands off the Medicare program. leave it as it is. And in fact, if anything, expand the program, the traditional Medicare program, the way it was originally intended, which was to cover everybody in this country. It would be far more efficient. It would give greater freedom of choice for both patients and providers, and to keep the hands of Wall Street entities off the Medicare program.
Thanks. Judy, what do you think?
Well, I mean, it does seem sometimes like it's hopeful, but I think what happened over the course of the past, I guess about a year, when some of the groups got wind of this DCE program and the actions that we took collectively, we did bring a petition to HHS and tried to deliver it to Secretary Becerra. 11,000 people signed this petition arguing against the DCE Reach DCE program. It was still DCEs then. We also met with a handful of members of Congress on the Hill, and we continued the pressure. We ran webinars. And after the first of the year, we also met with the head of the Centers for Medicare and Medicaid Innovation, Liz Fowler, in a remote call. And after the first of the year, they did take some notice, but we're not happy at all with what they did, which was to rename it and try to couch it under some equity, that this is going to help redistribute medical care to underserved populations, which is completely not anything that is likely the way that it's set up. So we continue to do those things. A lot of what we've been doing in Western Pennsylvania is trying to educate the candidates for the midterms, and try to hold their feet to the fire. Like, are you really? As Walter mentioned in the very beginning, it's very easy to say you're for universal health care, but what does that really mean? And we need to drill down on that. We need to work on these candidates that are taking hundreds of thousands of dollars in campaign contributions from the big health insurers. So it's a fight, no question.
That's great. So we've come to the end of today's show. I want to thank Dr. Judy Albert, Dr. Walter Tsou, for sharing your thoughts on this very important issue. Our producer is Jasmine Hanna, our station manager, Conni Bille. Thank you for spending time with us today. Our show is sponsored by Philly Neighborhood Networks. To learn more about us, go to www.phillynn.org. I'm your host, Tim Brown. Catch you next time on Talking in the Neighborhood.